production of prostaglandins, which stimulate increasing myometrial contractility and pain. And we know that dysmenorrheic women have higher levels of prostaglandins compared to eumenorrheic women. It often may be accompanied by systemic symptoms including diarrhea, nausea, vomiting, and this is a common misconception amongst patients and providers that when there's that degree of pain there must be some underlying pathology, when in fact it's just primary dysmenorrhea, painful periods.
So dysmenorrhea is what Madeline had as a vegan, and I want to do what none of the vegans will ever do, and that is break down the mechanism. So we're not going to spend too much time on dysmenorrhea. We want to look at what causes this, because this isn't just for Madeline. This is very, very common in women, of the age of having a cycle and, ovulation and whatnot. And as I've said before, your period is just that lining. It's the tissue that is prepping to house a baby. And it requires every nutrient you can possibly imagine. And it puts it all into that lining. And then when the egg is not fertilized every month, your hormones cause these contractions and your lining is released, and then it's ready to start this all over again and do it the next month. So I only mention all this because prostaglandins come in here. And prostaglandins are sort of like a hormone. They thought they were when they first discovered them in the prostate. And they are compounds or molecules that are released, made from arachidonic acid. And then they're found all over the body. So anytime they're important, they cause the inflammation and they cause the swelling when you're injured or something like this. But if there's an overproduction unnecessarily, this is where the pain, the intensity comes in, and it can be very uncomfortable. And the thing is, a lot of women suffer with this dysmenorrhea, which is the overproduction of the prostaglandins. And so what I want to do is try to understand why this is and why fish and eggs helped her.
Have profound effects on the velocity of nerve conduction, on the amplitude of action potentials, on the amounts of neurotransmitters released at nerve endings, and on the postsynaptic actions of transmitters.
Now, Kayla Rebecca mentioned a study that showed that women who eat fish have reduced period cramps. And so this got me thinking about why this is. Michelle Lowe even mentioned a study, but, of course, she said that and the way they conducted it was flawed and all of this, of course. And there are multiple studies. I'm not even going to get into the studies. I want to understand why this is so, because I've even heard people mention that eating too high carb, and this was shown in some of the research as well, that that can contribute to the pain. But I'm thinking now, after looking into all of this, that the high carb may just be a factor in eating a reduced amount of omega-3s.
DHA is supposed to be in your cell membranes, and you need it to properly resolve inflammation. So as inflammation runs its natural course, usually you use arachidonic acid to initiate the inflammation. You use arachidonic acid to get to peak inflammation. But then when you want to go back down to normal, you want to get rid of the inflammation, you still use arachidonic acid, but you also start using DHA. So they become partners in that cleanup process.
So this is the inflammation and the ratios of omega-3 and 6 that we're always hearing about. And that's what this is all about. The arachidonic acid is omega-6, and it's producing all these prostaglandins because there isn't enough EPA and DHA available in the cells to help, calm that. It's like a balancing act. It's a homeostasis. So I'd say it's as simple as that. It's about, balancing these fats that the vegan diet or even the SAD diet is completely lacking in. And then you have, a lower production of these prostaglandins, less inflammation, and things resolve on their own. Every cell in your body needs these fats. And I'd say it's the same thing with cholesterol. Vegans talk about how we produce our own cholesterol. Yes, but this is tightly regulated by your intake of cholesterol. There are these balances that happen in the body, that require the intake as well. You can't be expected to convert and make and form everything on your own. And, they will say, well, what's so magical about an egg? What is in an egg that you couldn't have got from a plant? What is in a fish, a piece of fish that you couldn't have got from a plant? And, again, this is so obvious. I mean, they know the answer. They know the answer. It's DHA, it's EPA, it's B12, it's cholesterol. I mean, there's so many things, first of all. But secondly, it's packaged together in one place. It's nature's multivitamin in a way that's bioavailable, not surrounded by fiber, so it's moving through you quickly, not having to be converted. So there's no plant in nature that can provide you with this full package. And as I just explained with the DHA and arachidonic acid, a lot of these nutrients work off of one another synergistically. So when you ask what's so magical about an egg, it's kind of like, where the list goes on. Where do you want me to start? It's bioavailable. It has everything you need in one place. It doesn't have to be converted. You can be assured it's going to be absorbed. That your cells are going to get everything they need in a balanced way. That it's not going to move through you so quickly like it does with fiber, like all these other little micronutrients do with fiber. That everything is there again. A lot of things that just aren't there in plants. And on top of all of this, the conversion processes are so unique between each individual. It is impossible to say that every human can eat the exact same plant-based diet and get the same outcome. It is an outright lie to act as if they all can do that. It is a lie. We have the research available to see that ALA cannot be converted in humans as they reach adolescence and adulthood. The conversion rates just keep going down, okay? And you may say, well, fish get their DHA from algae, so why not just take the supplementation there? Well, every ex-vegan says that's what they were doing. And then they start eating fish, and boom, their symptoms they find so much relief. Why is that? I mean, is the first assumption to be that they are just all lying? I think that would be irrational. I think that would be very irrational. Of course, it's probable that some are lying. That's possible. I'll give you that. But it's not possible that they are all lying, and we know the complications that come with supplementation. Otherwise, why not just take a handful of pills every day and eat a bunch of grass? Why wouldn't that suffice? If you believe the issue is energy, do you think we could live on pasta with all the other supplementations we need? Just, account for every other micronutrient. Take your iodine, take your algae, take your B12, and just eat pasta every day. Nothing else, just pasta. Do you think you could be healthy? Do you think you would be uptaking everything and synthesizing everything that you need? If you think the answer is yes, then there's no hope. Please, I don't know what to tell you. There's no hope. So let's get to the conversions of ALA. And you can click on any study. There are so many. So it says most studies in humans have shown that whereas the conversion of high doses of ALA to EPA occurs, conversion to DHA is severely restricted. The use of ALA labeled with radioscopic suggested that with the background diet high in saturated fat, conversion to long-chain metabolites is approximately 6%. for EPA and 3.8% for DHA. With the diet rich in N6, PUFA conversion is reduced by 40 to 50%. Restricted conversion to DHA may be critical since evidence has been increasing that this long-chain metabolite has an autonomous function in the brain retina spermatozoa, where it is the most prominent fatty acid. Neonate deficiency is associated with visual impairment, abnormalities, and delayed cognitive development. Adults, the potential role of DHA in neurological functions still needs to be investigated. So it's implicated in cardiovascular risk and so on. Here we have another one saying that omega-3 fatty acids, EPA, and DHA can be synthesized from ALA, but due to low conversion efficiency, it is recommended to consume foods rich in these fats. And here we are again. While some moderate net rise of the level of EPA was found, no net rise of the level of circulating DHA was found across the various fatty acid mixtures and ratios. This early evidence for the very limited conversion of ALA into DHA has been supported subsequently by other controlled studies in humans using measurements. For example, the feeding of 10.7 grams of ALA from flaxseed oil over a 4-week period failed to provide any significant net rise in the low levels of DHA present in the breast milk of lactating women. And this is another thing. There are plenty of studies on lactating women and measuring the amount of ALA or DHA that's found in their breast milk. Vegan women have higher levels of omega-6 in their breast milk. And, I mean, calling this an inferior diet is a fact. I'm just not understanding why vegans can't honestly evaluate this and logically say, okay, well, it looks like, maybe some people can do this, maybe not all. So to assume when you see an ex-vegan who says that they immediately felt better when they began eating fish or eggs, one of these foods that has, again, everything and has many nutrients that just are not in plants, to assume that they are lying is just completely irrational, knowing what we know, knowing about conversions. So if your next jump is to say they should just be piling on more, more calories, more bulk, more flax seeds, more hemp seeds, more. At what point do you conclude that it's just too much for a small woman who's eating over 3,000 calories a day? Are you really suggesting that she should be filling her stomach full to the brim every second, every moment that she is awake throughout the day just to possibly maybe make a less than optimal conversion? This is the definition of inferior. If you can relax and be lackadaisical about, I'll just eat some eggs here, this here, that's there. Maybe I'm not always full. Maybe sometimes I take a break completely and just don't eat for half the day. And you can still get everything you need. That's what you call superior. That is a superior diet because you're getting everything you need in smaller quantities of food. It's nutrient dense. It's calorie dense. Okay, so before I get too off track here, we're looking at a randomized control study. This is the best kind. And if you're wondering why we're looking at uterine contractions for preterm birth, and what that has to do with dysmenorrhea and the pain that women get when they have their period. Well, this is basically the same thing. The production of prostaglandins and the inflammation is the contractions you'll have, when you're delivering a baby. And this is your cycle every month. You have those contractions to empty out the bleeding in the tissue, and this is where the pain comes in, having too many of those prostaglandins, too much of the inflammation. So yeah, this sort of study could give us the same sort of conclusions that, if we were looking at DHA and actual dysmenorrhea, like period cramps. And I like this one because they use suppositories. And so it's pretty clear. It's cut and dry, did it help or did it not? We've got the arachidonic acid producing the prostaglandins and the inflammation and the DHA that was lacking before, obviously. You include that, and then you have lower contractions, you have less pain, so on and so forth. When I was pregnant this last time, I was wanting to go into labor, and I was told to take evening primrose oil to use as a suppository and take it internally. And evening primrose oil, this makes sense because it's GLA. It is an omega-6. So it would have the opposite effect, right, if it were an omega-3. So an omega-6 would, I guess, cause more inflammation, more, you want to get those contractions going, you want to get the labor started, that sort of thing. So I'm not going to read this entire thing. You can pause and do that if you would like. You get the idea. They were controlled into groups. Some were given placebo, some were given the DHA capsules. In this study, we observed that vaginally administered DHA during pregnancy acts on uterine contractions in symptomatic women, resulting in muscle relaxation and induces disappearance of spontaneous contractions in many cases. Several randomized controls have shown that supplementation with omega-3 may influence the birth process by delaying the onset of labor, reducing the risk of recurrent preterm birth. And in animal studies, it seems to have a tachylytic effect. The exact DHA's mechanisms of action are not well understood. Changes in the myometrial contractions and the connective tissue remodeling seem involved. High omega-6 to 3 fatty acid ratio will result in increasing pro-inflammatory production. These metabolites have been associated with labor in term and preterm. A higher intake of omega-3 fatty acids leads to a downregulation of the synthesis of omega-6 fatty acids and consequently reduces the production of prostaglandins responsible for cervical changes in early labor. I wanted to talk about cytokines and how it lowers them and they're associated with labor. And so basically, to wrap it up, it's a balancing act. It's getting your body to a state of homeostasis, and that requires eating the full spectrum of nutrients, not restricting. Especially as a woman, if you want things to work well, as a man as well, but speaking specifically to the ladies, when we're dealing with our monthly cycle and hormones, omega-3s are so crucial. Every cell in our body is made of fat. We need DHA.